Hello, students. Have you ever wondered why some couples struggle to have children? In the world around us, infertility is a growing issue affecting many couples who are eager to start a family. But what exactly is infertility? It's defined as the inability to conceive after a year of regular, unprotected sexual intercourse. But infertility isn't just one thing. It can be caused by a variety of factors in both men and women. Let's dive into the world of human reproduction. For conception to occur, a woman's egg must meet a man's sperm, and the fertilized egg must successfully implant in the uterus. But when things go wrong in this process, infertility happens. Imagine this process as a delicate chain of events, each step vital for success. So, what happens when one of those steps fails? Take a look at this diagram of the female reproductive system. As you can see, the egg must travel from the ovaries through the fallopian tubes and into the uterus. Any obstruction along the way can lead to infertility.
Now, let's focus on female infertility. Many factors can cause infertility in women, but one of the most common culprits is ovulation disorders. The ovaries must release a mature egg each month, but in some women, ovulation doesn't happen regularly. This can be due to hormonal imbalances or conditions like polycystic ovary syndrome or PCOS. Blocked fallopian tubes are another big issue. These tubes are like highways, helping the egg reach the sperm. If they're blocked, sperm can't reach the egg, and fertilization becomes impossible. Conditions like endometriosis, where the lining of the uterus grows outside the uterus, can cause this blockage. Even the uterus itself can pose problems. Issues like fibroids or non-cancerous growths in the uterus can affect implantation, making it hard for the fertilized egg to attach and grow. Take a moment to think about how age affects fertility. As women get older, their egg quality and quantity decrease, which can make it harder to conceive. Infertility doesn't only affect women. In fact, male infertility is just as common. One of the most frequent causes is low sperm count. This means the number of sperm in the semen is too low for successful fertilization to happen. Another problem is poor sperm motility. That's the sperm's ability to swim toward the egg. If sperm can't swim well enough, they may never reach the egg. This can happen due to issues with the sperm's tail, or even environmental factors like smoking or exposure to toxins. Now, let's take a look at the male reproductive system. Here, we have the testes, where sperm are made. If the testes are damaged, it can affect sperm production. Conditions like varicocele, which is a swelling of veins in the scrotum, can also decrease sperm production. Just like in women, lifestyle factors play a significant role. Smoking, excessive alcohol, and poor nutrition can all lower sperm count and motility. So, how do doctors figure out what's causing infertility? Well, there are several tests that help diagnose it. For men, the semen analysis is one of the first tests. It looks at sperm count, motility, and shape, important factors in determining if sperm can fertilize an egg. For women, the first step is often testing hormone levels. This helps identify if there are any problems with ovulation. Another important test is hysterosalpingography, or HSG. This is where a special dye is injected into the uterus to check for any blockages in the fallopian tubes. Doctors also sometimes use laparoscopy, a procedure where a small camera is inserted into the abdomen to get a closer look at the reproductive organs and check for conditions like endometriosis. As you can see in this diagram, the HSG test shows whether the fallopian tubes are open or blocked. Now that we understand the causes and diagnosis of infertility, let's look at treatment options. For women with ovulation problems, doctors often prescribe medication like Clomid. This helps stimulate the ovaries to release eggs. In cases where the fallopian tubes are blocked, surgery might be needed to clear the blockage. However, if these treatments don't work, in vitro fertilization, IVF, is often the next step. IVF involves fertilizing an egg outside the body in a laboratory. The fertilized embryo is then implanted into the woman's uterus. This is a huge advancement in reproductive technology, but it's not always the first option due to its complexity and cost. Male infertility treatments can include hormone therapy to boost sperm production or surgery for conditions like varicocele. In some cases, sperm can be retrieved directly from the testes if the man has low sperm count. While infertility treatments can be life-changing, they also raise important ethical and social questions. For example, who owns the embryos created during IVF? And what happens to the unused embryos? In some cultures, infertility is still a taboo subject, and the pressure on women to conceive can be overwhelming. Assisted reproductive technologies like sperm or egg donation can also be a sensitive topic. But despite the challenges, these treatments give hope to many families. Assisted reproduction is not just a medical procedure, it's a way for people to overcome biological obstacles and fulfill their dreams of becoming parents.
So, let's quickly review what we've learned about infertility. We explored how both men and women can face challenges when trying to conceive, from hormonal imbalances to physical blockages. We've also learned about the different diagnostic tests that can help pinpoint the cause of infertility. We also looked at treatment options like IVF and medications that help women ovulate. And we discussed the ethical and social implications of infertility treatments, how they impact not only the medical field, but also society at large. Isn't it amazing how much we've discovered about the complex process of reproduction? From the microscopic sperm and eggs to the advanced technologies that help overcome infertility, the science of reproduction is truly a marvel. Biology helps us understand not only how we reproduce, but how life itself continues to evolve and adapt. Remember, the same biological processes we've studied today are working inside your body every day. Life truly is the most fascinating science. Until next time, keep wondering, keep learning, and keep exploring the incredible world of biology.